Welcome, and thanks for joining me. Today we're going to talk about celiac disease, specifically 3 myths about celiac disease that keep patients from a correct diagnosis. So we're going to jump right in. We're going to talk about my why. So why celiac disease? And really it is this guy. This is my son. In this particular picture, he's 5 years old, 4 to 5. And it's a little bit hard to see, but you can see he's got a really big kind of red patch on his cheek. So what healthy child, kind of birth, beginning of life, everything was going along. And in his 4th to 5th year of life, he started developing rashes on his cheeks. So he'd be rubbing his eyes, he'd wake up, he'd be fine, and by the end of the day he'd have these big circles under his eyes, itchy eyes. He was diagnosed with allergies at the doctors. We tried antihistamines, and then low energy, like couldn't walk to school. It was and we lived 6 blocks from the school, and I was like, the mother's instinct, something was definitely wrong. So as a naturopathic doctor, we're looking, food is definitely related. We started going down that path, looking at different food sensitivities, changed up diet, things like that. And eventually when we got those results back, they were just very interesting to me as a naturopath. They very reactive, lots of leaky gut type symptoms, nothing reactive to the gluten-free grains. And so it was more on just kind of a hunch. I asked the doctor to test for celiac disease. And so, again, I feel very lucky. It came back positive. The doctor was very surprised and wondered why we had tested it. But feel very lucky that we were able to find this early on for him. And so this is my why, because I don't want people to be confused or to miss the diagnosis when lives can change so dramatically once you have the correct diagnosis. So a little bit about me. My name is Dr. Clare Sullivan. I'm a naturopathic doctor, mother of 3, so that's my middle son. There I have 2 daughters. My clinical practice focuses on digestive health. Anything from IBS, SIBO, irritable bowel syndrome, or IBD, and celiac disease as well falls into that. We look at all aspects of health when you come in, but really a lot of our overall health starts in the digestive tract. So very, very interesting for me and super impactful for patients. I love creating and making things. I love being in the kitchen, the garden, and being with my children. And that's a little bit about me. So let's jump into, we're going to start with some statistics about celiac disease. So everyone here is going to have different knowledge about celiac disease and what it is. But we'll start with statistics, and then we'll just talk about a little bit more about what it is for people who don't know what exactly it is. Celiac disease affects 1% of the population. So in Canada, that's about 1 in about 100 to 114 people. But in that 1 to 200 people population range, we're going to have 1 person with celiac disease. If you have a first degree relative, so mother, brother, father, sister, in that first degree relative group, if someone has celiac disease, the risk of you having celiac disease increases from 1% to 10%, which means that if someone in your family has celiac disease, everyone in the family should be tested for celiac disease. With those statistics in mind, we know that about 90% of celiac disease cases remain undiagnosed. So it is not something that the number of people that have celiac disease that don't know it is still quite high, which is very impactful for long-term health. Another very interesting statistic is the actual mean delay in proper diagnosis is about almost 12 years. And so that's part of, again, my why to change that number and decrease the number of years it takes to diagnose properly. What exactly is celiac disease? Celiac disease is an autoimmune disease. So the immune system, we know, is super important. It helps fight off foreign bodies, viruses, bacteria, and it's very good at recognizing something as foreign to our bodies. In the case of celiac disease or autoimmune diseases, what happens is that our immune system gets confused and it starts to attack our own body. In the case of celiac disease, it affects these villi. So these little finger-like projections that are in your small intestines, and they are where our nutrients are absorbed. So as we go through some of the myths, we're going to talk about certain nutrients that are impactful for each one. But those are where the nutrients are absorbed. So if you think about having these little finger-like projections, we have all of this surface area that is absorbing nutrients. So when we have celiac disease, what happens is our immune system starts to attack these and they start to shrink. And then eventually, depending on the severity of celiac disease and how long it has been present, they can actually flatten right out. So we compare, there's about, one finger worth of absorptive area versus all of this area. And so celiac turns out to be like a disease of malnutrition in the end. It is triggered by gluten. So once the immune system is turned on, the trigger for it is gluten, and that is found in wheat, rye, and barley. And the other piece that I really wanted to touch on is that autoimmune diseases are like a light switch. So something turns them on, and then what happens is that we can't then turn it off. We can dim the symptoms of an autoimmune disease, but they're always present. So we do have to be cognizant of that, and we want to decrease the impact that it's having on your life, but it is a lifelong condition. So these are the myths that we are going to chat about. So we have myth number one, the celiac disease only causes digestive symptoms. Myth number two, celiac disease only develops in childhood. And myth number three, going gluten-free is a good way to test if I have celiac disease. So let's jump into these myths. Here I've listed the signs and symptoms, and I apologize, I don't know, the one is on my left that says abdominal distension. One is on the right. It says chronic itchy eyes. So I separated these, and it might be flipped on your screen. But the list that starts with abdominal distension are the symptoms, the signs and symptoms that we often associate with celiac disease. So people come in and they are complaining about abdominal pain, gas and bloating, chronic diarrhea. This can be lots of things. It's not specific to celiac disease. People could have IBS, they could have food poisoning, they could have food sensitivities, they could have IBD, or inflammatory bowel disease. Like, it's not specific for celiac disease, but these are often associated with celiac disease. Weight loss, poor growth in children, or failure to thrive, muscle wasting. So that's when I was talking about those nutrients not being absorbed. We have signs of malnutrition happening. We can also have chronic constipation. So it can go either way. Fatigue is huge, right? If we're not getting the nutrients that we need, fatigue can be a big symptom. And another big symptom, unexplained iron or folate deficiency. So this is something that comes up because it's one of the nutrients that is screened for on a regular basis with your medical doctor. We generally look, if someone has fatigue, we're going to look for iron levels. The second list, and we're going to go through some of these in more detail, are ones that we don't right off the bat associate with celiac disease. And so we talk about kind of skin issues. We're going to talk about elevated liver enzymes, bone health, hormonal health, and mood health. Mood can be huge for people on several levels. Okay, so pre-diagnosis, malnutrition will contribute to low mood. Gluten exposure, once we've had diagnosis, if patients have an accidental exposure to gluten, there can be repercussions around mood. And then being diagnosed with an autoimmune disease will also affect mood and can contribute to depression. And we want to make sure that we are screening for that and that we are supporting patients on that journey. So let's dive into each one of these. So bone issues, right off the bat. So we were talking about that lining in the small intestines. And if that is being attacked, the nutrients that are really important for bone health that are not being absorbed are calcium and vitamin D. So one interesting fact, if someone does have a diagnosis of celiac disease, under OHIP, their vitamin D will be tested yearly to ensure that they are getting adequate levels. So that's just a little side note there. But we want to make sure that we are getting those nutrients for optimal bone health. So this is something that for sure we want to, once we have a diagnosis, but we see this often in perhaps older patients. It can happen at any age, but if we're seeing frequent fractures in a population that's not prone to osteoporosis, so we're not looking at little frail old elderly women. We're seeing this in younger women. We're seeing this in children or teenagers or men with osteoporosis. Once we have a diagnosis of osteoporosis, the problem is that we often don't have a diagnosis of osteoporosis until there is a bone fracture. So it's not something that's generally screened until your senior years. But if someone is having chronic bone pain or frequent fractures, it would be something to consider looking into. And for sure, if there's an early diagnosis of osteoporosis, it would be another reason to screen for celiac disease. Neurological symptoms. So this is your nerve health. And symptoms affecting the nerves can be present before or after diagnosis with celiac disease. Going back to those small intestines and the nutrients that are important for nerve health, we have folate, vitamin B12, vitamin E. These are all going to help support the health of our nervous system. Symptoms that can present outside or outside of intestinal symptoms. So, you're not having any of the abdominal pain, the digestive issues. But they can be present with them as well. Peripheral neuropathy. So we're getting tingling and pain, numbness in our extremities. So our hands, our feet. Generally we will start by screening for low vitamin B12 or low folate. And that would be something to look at. Higher incidence of epilepsy or seizures. This is not across the board in terms of if you have celiac disease, you're going to have epilepsy, but there's a higher incidence in the celiac population. Migraine headaches. So again, this is in not all cases of celiac disease, but in cases where you may have migraine headaches and treatment is not working. So it's refractory. We are not seeing any improvement. We're not finding a cause per se. It is worth screening for celiac disease because it can be impacting your nerve health and can be impacting those headaches. Gluten ataxia. So this is issues with movement, and gluten almost acts like a drug. So what happens is it affects the nerve health, and then we get jerky movements following consumption, like following eating gluten. So gluten ataxia absolutely can be present in celiac disease. It can also be present without the the presence of celiac disease, and would be a separate diagnosis where someone is just responding to gluten. But yeah, we get lots of like jerky movements. A lot of brain fog can happen. And then once the gluten has kind of cleared the system, movements will go back to normal. So it's not something that is going to stick around once the gluten is out of your system, but it's a very specific response when gluten is consumed or eaten. Dermatitis herpetiformis. So this is a skin condition. It looks, and the name is based on, it looks like herpes. So a small blister type rashes that appear. Both sides of the body are affected. So we're not looking at one side of the body. It's very symmetrical in terms of how it presents. And it's basically celiac disease of the skin. So again, it can be present with gastrointestinal symptoms or digestive symptoms, but it can be present without that as well. It is diagnosed by skin biopsy. So we're looking for those antibodies in the skin. And about 10% of patients with celiac disease will have dermatitis herpetiformis. The symptoms, because it can look like eczema, sometimes like it's red, it's patchy, it's dry, it's itchy. But one of the differentiating symptoms is that there's a extreme burning sensation that goes along with the itchiness. And the second kind of differentiating factor is that when we remove gluten, the skin improves. So this is not the only skin condition. Like I was saying about my son, he would eat it and he would get rashes under his eyes. Itchy skin can happen and just rashes generally, but this is a very specific celiac disease of the skin that we only see in celiac patients. Reproductive problems. So this is another area that women will begin to have problems with reproduction or infertility issues. They're unable to get pregnant, or they're getting pregnant and they're having frequent miscarriages. And then after a while, their doctor is wondering what's happening, and we screen for celiac disease. Nutrient deficiencies that can, again, we're not, the jury's still out in terms of understanding fully why this is happening, but some of the nutrients and suspected causes of it include folic acid deficiency, zinc, and selenium. A low body mass index, so that malnutrition side of celiac disease, can impact hormones, which is going to impact fertility. So those would be in patients that cannot get pregnant. And in patients that can get pregnant, there is an increased risk of spontaneous miscarriage or preterm labor. So the good news is that once there is a diagnosis of celiac disease, a woman's risk will return to the same risk as the general population. So this is, having celiac disease does not increase your risk of reproductive problems, but it does if you are not diagnosed with celiac disease. So if it is undiagnosed. So that there's a little glimmer of hope there. We're going, if we can get a proper diagnosis and we can remove gluten from the diet, fertility issues can often resolve on their own. So those are kind of areas that sometimes don't get flagged when we're looking for a root cause of what is going on, but need to be in our awareness. Myth number 2, and this comes up a lot when I am talking to patients about the possibility of testing or ruling out celiac disease, is that they will say, I can't have celiac disease because I've been healthy my whole life, and now I'm 30 or now I'm 60 and I just can't have celiac disease because I've been eating gluten my whole life. So I understand that. The thing is, celiac disease can develop at any time after the introduction to gluten. You're not born with it. It is an autoimmune disease that turns on at some point in your life. But anytime after the age of gluten introduction, around 6 to 9 months of age, people can develop celiac disease. The average age of diagnosis in Canada is between 45 and 46. So that gives us some perspective as well. And it typically takes about 12 years to get a diagnosis in Canada, going back to our statistics page that we want to change. Risk factors for developing an autoimmune disease. So we talked already about that genetic link when we're talking about family history and first degree relatives. So there is a genetic predisposition to autoimmune diseases and celiac disease. If we have the genes that are present, it does not guarantee that we will develop it, but something can trigger our immune system to kind of go haywire or out of whack. So exposure to infections, exposures to chemicals or trauma, different medications, all of these things can, in some certain circumstances, be a trigger that turns on the immune system in a way that is inappropriate. And so once it recognizes the body as foreign, then we are on the autoimmune disease kind of path or spectrum. Once we have an autoimmune disease, there is an increased risk of developing further autoimmune diseases because the immune system has already been primed. So we'll talk about it in a few slides, the part of the role of naturopathic doctors and working with a naturopathic doctor is to prevent further autoimmune diseases from occurring. Myth number 3, going gluten-free is a good way to test if I have celiac disease. So that is an absolute no. There are lots of reasons why you might feel better going on a gluten-free diet. And there's no harm necessarily in going on a gluten-free diet. However, if you do have celiac disease and you go on a gluten-free diet, you will feel better, but it's going to be very hard to convince you to reintroduce it to get a proper diagnosis of celiac disease. So first, let's just talk about some of the reasons you might feel better going on a gluten-free diet. Absolutely, it could be celiac disease. It could be a wheat allergy where you are creating different antibodies, so IgE type reaction to gluten. Could be a food sensitivity to wheat or gluten. It could be a reaction to fructans, which is when we're talking about a low FODMAP diet, those carbohydrates in wheat and rye and barley that can aggravate irritable bowel types syndrome symptoms. And it can also be a non-celiac gluten sensitivity. So many reasons why you could be feeling better. The issue is the proper diagnosis. So what happens if you are already gluten-free? What are our steps? So there's a few things to consider. If it has been less than a month, you can still do the blood test for that tissue transglutaminase, that TTG. And that's the preliminary test to kind of see where you are at. Are there antibodies being made to your cells? If it has been more than a month, what we can do before we reintroduce gluten is test genes. So naturopathic doctors cannot do the genetic testing, but your doctor could do the genetic testing. If you do not have the genes for celiac disease, you do not need to do a celiac or a gluten reintroduction. You cannot have celiac disease if you don't have the genes. If you do have the genes, we cannot rule celiac disease in or out without the gluten challenge. So if you have the genes present, the next step would be to consider doing a gluten challenge. And some of the guidelines around that have changed, so it is not quite as intense as previous. But if you do have celiac disease, it is a tough reintroduction challenge to do. You can test after 2 weeks. If it is negative, you have to continue for another 2 weeks, retest, and another 2 weeks, retest. So it can be quite costly if we want to do the test properly, but really important to get that proper diagnosis. And then once, if we do have a positive TTG test, you would be staying on gluten until you had that follow-up biopsy. So there are some workarounds, but those would be things to consider talking to your naturopathic doctor, your medical doctor, and if you have a gastroenterologist, to make sure that all of that is being considered. I threw this one in because it is something that, especially because there's so much gluten-free food and gluten-free options out there, we can often hop on the latest food trend. And the myth is that going on a gluten-free diet is a healthier diet. So it is true that with celiac disease, a strict gluten-free diet is necessary. And there are some people, non-celiac gluten sensitivity, there are people who need to be on a gluten-free diet or who feel better on a gluten-free diet. The false part of this myth is that not all gluten-free foods are healthy. And we can see that when we're walking through the aisle of prepared foods. So processed foods, whether they're gluten-free or not, have added sugars, they have added fats, they have saturated fats, added salt. All of these can impact our health. So we want to be cognizant of, are we eating a healthy gluten-free diet, or are we eating like a processed food gluten-free diet? Again, my preference leaning towards a whole foods diet, and also knowing that, there are times when we need a little bit of convenience in there as well. There's a few other concerns that do come up when we're talking about a gluten-free diet that I wanted to touch on. So number one is that it is lower in fiber. So when we're removing those whole grains, we can work around this and we can make sure that we are choosing whole grains when we're talking about gluten-free grains like rice or quinoa or millet. So we do want to include some of those whole grains, but that is something to consider, and constipation can be an issue if we're kind of reaching for a lot of the prepared foods, because they are made with the starches, which act like the glue that gluten is when we're making breads and baked goods. Another concern is that the gluten-free diet is generally lower in B12. The reason for this is that a lot of the wheat-containing products are fortified with B12 because the powers that be have mandated this, and the gluten-free foods are not necessarily fortified with it. So some of the cereals might be, but other like bread products and such are not fortified. So we have kind of a double whammy of, we have poor absorption of B12 and then we have less fortified foods of B12. It is something that you would want to monitor on a yearly basis and potentially supplement if those numbers are low. The third is cross-contamination, and this is less of a concern if you're preparing your own foods, but we do have to have conversations around preparing your own food and having a safe space in your kitchen if it's a mixed kitchen. But this is when we're going out into the world. So, there's lots of gluten-free options available these days at coffee shops, at restaurants. And so if someone does have celiac disease, we just have to be very careful about, does the restaurant understand what it means to be strictly gluten-free? Can they guarantee that? Or what are the steps that they take to make sure that there is no possible risk of having gluten or wheat or flour on the product that is claiming to be gluten-free? The reason for that is that celiac disease is not, it's not dose dependent. You can have a very small dose, crumbs from a toaster, a bit of flour on a baked good can trigger the immune system because your immune system is so vigilant. So we really want to be careful and cognizant about how we are eating when we are out. The role of naturopathic medicine. So I touched on it briefly before, but we want to monitor and prevent further autoimmune diseases from developing. So we are going to support detoxification when we're talking about chemicals, toxins, exposures in our environment. We're going to manage the impact of stress and talk about mindset. We're going to work with the digestive tract to make sure we're eliminating, supporting all of the areas that our body eliminates through, including our skin, our kidneys, our breathing, our lymphatic system. So really helping to prevent further autoimmune diseases from occurring. We are going to monitor and support health maintenance. So through nutritional assessment, making sure that we're getting an adequate fiber and hydration, those vitamins and minerals we're going to look for and make sure there are not nutrient deficiencies. So this can be done again on a yearly basis, but we're also just monitoring for signs and symptoms at the same time. We want to heal up that gut. So once there's a diagnosis that's been made, we want to support healing of those villi because they can reform and they can heal. And then decreasing any inflammation in the digestive tract that has occurred as a result of celiac disease. We also want to decrease any long-term risks of celiac disease. So we're looking at bone health markers. We're supporting liver health. We are making sure that once we have this correct diagnosis of celiac disease, that there's nothing else going on with the reproductive system, so we can get back to that baseline of the general population. The mood piece is, again, I mentioned this quite early on, but we're talking about mood from many aspects. We're talking about how food impacts our mood. We're talking about also how the diagnosis impacts mood. And we want to monitor that and make sure that our patients have the support that they need through this journey. We want to talk about immune health. So we know that the immune system is very vigilant. It's seeing our body as foreign. And so we want to make sure that we can support the immune system, that it is also seeing some of the foreign invaders, such as viruses or bacteria, as foreign, and that they are paying attention to what's going on there as well. We want to monitor weight, both in terms of being underweight, and also when we're talking about that gluten-free diet, if it's more of a processed food diet, how are we managing weight if weight gain is an issue. The other concern that can come up, and again, when we're talking about autoimmune disease spectrum, but if thyroid is impacted, weight gain can be a sign of that. So if we have a low functioning thyroid, weight gain can be an issue. And so it would be something to screen for. And improving energy. So this is something that everyone would love a little bit more of. And those are going to come from what we were talking about earlier about nutrients. We want to move our bodies. We want to hydrate. We want to support mood. So lots of different areas where we can support energy. And then education and patient advocacy. This is a huge piece of my practice. We want, or I want to make sure that, patients understand what's going on with their body. I want them to feel confident talking to their health care team about what's going on in their body. I want you to understand what the labs mean when you get them back, so that you feel confident being able to advocate for yourself as well. These are a few resources. The Canadian Celiac Association does a wonderful job. They put on a yearly conference. The last few years it has been virtual, obviously. They have resources for newly diagnosed patients. They have a YouTube channel with videos talking about cross-contamination. Lots and lots of resources out there for patients. Sometimes it's just navigating and understanding how to go through it. They also have very active local Facebook pages, so specific to each city that you're in, which is a great way to meet other celiac patients, and also just to kind of navigate some of the products that are out there, what's good, what's not. Has there been a recall? Great way to kind of keep your pulse on the gluten-free and celiac community. This was another study that I was looking at in terms of pulling some of the statistics. Lots and lots of resources out there, and happy to have you contact me if you have any questions as well. So here's my contact information. I work at Somerset Health and Wellness Center here in Ottawa, which is an amazing team of practitioners. This is my guy now. So we're, 6-7 years in. He is full of energy. He loves to climb. And I feel very grateful that we were able to find that diagnosis earlier. It makes me a little bit teary to think about, but just full of joy and growth. So that's him up in a tree, his favorite spot to be. And those are my contact information if you have any questions. Okay. If we were in person, you could ask me now, but otherwise you can reach out. I hope you have a wonderful rest of your day, and I would love to connect with you soon. Take care.